Welcome to The Scoop from the Lurie Cancer Center's Adolescent and Young Adult, or AYA Cancer Program. We bring together AYA cancer survivors and experts to answer important AYA cancer-related questions. We hope you enjoy the conversation today.
Welcome to The Scoop. Thanks so much for being here with us today. We're talking about exercise and cancer. We'll get started with a few introductions. I'm Melissa Duffy, and I'm a physician assistant at Northwestern's Cancer Survivorship Institute. On the side, I teach group fitness classes. Jenny?
Hi, everyone. Thank you so much for having me a part of the Scoop today. I'm very excited. My name is Jenny Spencer. I have an oncology nursing background, and I am founder of Sites of Fatigue, where I provide cancer exercise programming.
Hi, I'm Lauren LaPriori. I am an AYA breast cancer survivor, and I'm also on Board 39 as a board member.
So let's go ahead and jump in. Jenny, we have a few questions for you. We're hoping that everyone finds our conversation helpful. Before we get into our questions, we thought it might be fun to start with a little warm-up. Take it away.
Great. So I am actually going to stand up to do this warm-up. It is a upper extremity lymphedema warm-up series that you would practice if you were at risk for upper extremity lymphedema based on your cancer treatment or surgery, radiation, things like that. So we are going to get started with just some deep belly breathing. I'm going to have you bring one hand to your belly, one hand to your chest. You can do this sitting or standing. And you're going to take a deep breath in through your nose, enough so you still feel your belly expanding. So deep belly breathing, 4 counts. And then out, 4. We're going to do this 3 more times. So keep going at your own pace. Make sure you feel your belly rise and expand, and then release. This is a very important part of this warm-up series to start at the beginning because it really helps activate your lymphatic system flow. Your lymphatic system doesn't have a pump like your heart to pump your vascular system. So it relies on other measures like your skeletal muscle contraction, your movement, and some valvular mechanisms within the lymphatic system. So that is why we start with deep belly breathing. Now we're going to go into a pelvic tilt. So we're going to take our hands or our fingers and we're going to put them right at the front and the back of our pelvic bone. And you're going to do a slight action where you're bringing your coccyx bone toward your front pubic bone and you're doing a little tilt like this. So tilt up like this. Perfect. And while you're doing this, you're still breathing. Good. Do it 2 more times. Good. Now we're going to bring our arms up and act like we have a yoga ball kind of in between our hands and say we were sitting in between our knees, so or our upper leg, so our thighs and our hands, and you're pushing down so that you're feeling your core activate, those muscles in your abdomen. So you're breathing, and as you breathe out, push through as if you're feeling that force underneath your palms. And let go. And again. Good. One more time. Good. And now we're just going to we're going to do some neck stretches, but they're going to be dynamic in nature. So you're just bringing your left ear to your left shoulder, right ear to your right shoulder, and going back and forth in a nice, flowy manner. You're making sure you're breathing. Good. Good. And now we're going to go into some shoulder shrugs. So you're bringing your shoulders up to your ears and then bringing them back down. Up to your ears and back down. Good. Keep doing this movement. These movements, when you're warming up, are important to be dynamic in nature. I said that word a little bit ago. That means that they're fluid. So when you're warming up, you're activating your muscles, you're getting them ready to move. You're saying, we're going to start moving, start the flow. So you're warming them up. You're warming up your joints too. Good. Now we're going to go into shoulder rolls. So you're bringing your shoulders up and then back down your spine. And you're continuing to breathe as you do these movements. Good. It feels good even if you've been sitting at the desk for a little bit today. It helps open up your chest. Good. Now we're going to squeeze our shoulder blades together. So you're squeezing your shoulder blades and back forward. Your shoulders should be pulled away from your ear as you squeeze back and come back to forward. Squeeze. Good. 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 Now I want you to bring your hands together in front of you and push them together like you're doing an prayer pose. And you're holding for 1, 2, and release. 1, 2, put your palms together. Release. Good. 1, 2, release. 1, 2, release. Last one. 1, 2, release. Good. Bring your arms out, and we're just doing some arm circles. Nice and easy. Good. And now go backwards. Good. Now we're bringing our arms up if you can. If you have to keep them here, that's fine. And you're doing just some wrist circles. Good. Make sure you're breathing. Now I want you to extend and flex your wrist. Good. And lastly, let's make a fist clench and release. Fist clench, release. Good. Make sure you're breathing. Release. Release. Good. And that would be the end of an upper extremity lymph drainage warm-up series. I thought it'd be good to incorporate at the beginning, just so we can make a little bit of awareness that there are some accommodations and modifications you should make in your exercise programming if you are at risk for lymphedema. So I hope that helped loosen you up, and we're ready to go.
Thanks, Jenny. I'm totally loosened up. Thank you for that. And so, thank you for going through all of those, pre-treatment. Many times you don't really think about exercising. You're so focused on, your diagnosis and, kind of what your next steps are. But exercise is really important. Why is it so important pre-treatment?
That's a great question. So a lot of times it's very important for a number of reasons. Like you brought up, you don't really think about exercising when you get that initial diagnosis until you go through maybe the surgical procedure, your first step. So one, it can help relieve your nerves. It's really good for anxiety and depression. So exercise and moving is great for that, your mental and emotional health and well-being. Also, those who are active before surgery, whether they were active pre-diagnosis or after diagnosis, if they were active before they went to their surgical procedure, studies have found that they have shorter hospitalization stays and also shorter recovery times. So those are two huge factors in recovering. And when you think about it, surgery is a big stress on your body, right? So exercise is also a stress on your body when you're moving and you're continuing to grow and get stronger, but it's a good stress on your body. So in a way, exercise helps prepare you for the surgical intervention that is going to take place or what you're going to undergo. Another good reason is many of us have this rounded shoulder, forward head, posture. I actually was at breakfast earlier today and every single person waiting was like this. And I just wish I could have taken a picture because that really makes a lot of muscular imbalances within your posture. These chest muscles are tight. These shoulder muscles are weak, and certain cancer treatments, surgeries target those muscle areas. So it just further exacerbates that imbalance, which can really interfere with your range of motion in your upper extremities, and really the way you take care of yourself, because you have to be able to function well in order to, do the dishes or go get groceries and those types of things.
So thanks, Jenny, so much for answering that question. So now you're into treatment, and what suggestions do you have for someone while they're going through treatment? I know, I did a couple walks, around the block. At the time, I was going through chemo because that was kind of the only thing I could do at that time. But what other recommendations do you have just in general? Treatment, surgery, radiation?
Yeah, that's a great question. And I feel like a lot of people ask that. Before, we used to think during treatment, it was important to rest, recover, conserve your energy, all those things. We didn't really know if it was safe for you to move, because there wasn't really a lot of evidence to prove that it was safe to exercise if you're undergoing cancer treatment. But now we know that it is safe. Studies have continued to prove this, and they've also proven that it can help substantially with your energy, anxiety, depression. It can help with your physical functioning and also your quality of life. So I think when you're going through treatment, it's important for you and your family members, your caregivers, to recognize that exercise is a good thing. It's good to move, and it can actually help your outcomes too. Treatments can be very cyclic in nature. So some days you might feel great and some days you might not feel the best. So you understanding, the 3 days after I go in for treatment, I really don't feel well or I don't feel good. Maybe any type of movement, even if it's just walking around the kitchen island and you feel like you can't do it, just doing that a couple of times throughout the day. Any type of movement is good. But you also shouldn't put too much pressure on yourself to be, running 3 miles or even more the day after treatment if you don't feel like you physically can do that. So really being aware of your body and kind of finding that really good balance of knowing, I feel good these days. Let me maybe do a little bit more. I don't feel as well these days. Let me just try to walk for 5 minutes a couple times a day. What works well for you? I know you said your walk.
Yeah, really going for walks. I actually had little weights, 1 pound weights that I use here and there, just to move around. So yeah, thank you for those other recommendations.
Jenny, I was wondering if someone's treatment consists of having surgery, are there any recommendations you have for either pre or post surgery that you would tell them to do or not do?
Yeah, that's a great question. And a lot of times I defer to the surgical team. You should always make sure you talk with the surgeon, whoever you're seeing. There's a lot of restrictions that you might have, especially if you had breast cancer and you had a mastectomy or implants and things like that. Sometimes even with abdominal surgery, there are some restrictions and recovery period times that you have to wait to make sure that you're able to fully function after. So definitely checking with your care team and making sure when is it okay for me to start moving again, and what type of movement can I or can I not do. That would be definitely a top recommendation.
So now I have a question about, so you've had your treatment and now you're in survivorship. And so what does that look like? How do you look at exercising, at that time frame? And, kind of to add to that too, we're in Chicago, we're at Northwestern, and it's freezing cold, certain parts of the year. So how do you stay motivated? Get us motivated, Jenny.
Yeah, those are two great questions. So for your first one, survivorship phase, and everyone's survivorship phase looks different, right? Some people are still getting maintenance treatment during their survivorship phase, and some maybe are not. So everyone's survivorship phase, it doesn't look the same. So that's something to definitely consider. But during that time, you're getting back to normal living, or trying to, right? Maybe going back to work, taking care of your kids, things like that. So being active and using exercise as a tool to help you perform your functional movements better throughout the day is huge. Exercise can help you maybe learn how to do body mechanics better, where you're using your core better. So when you're picking up your kids and putting them on the high chair, you're activating the right muscles so you're not potentially having further injury or strain on your body. It's really a great way for you to start to acclimate to that normal living again. That being said, it's also important to be slow and progress slowly, so you don't do too much too fast and discourage yourself if you feel really sore or injure yourself because you kind of just went a little too quickly. There was a quote that I just learned: slow is smooth and smooth is fast. And it's so true, because if you're slowly progressing and working your way up to being active, or working way up to the guidelines, which we can go through too, then you're less at risk for having injury on your body. So you're going to slowly progress quicker than you would if you started to just run, 5 miles right off the bat once you started getting active again. So it can really be a great tool for you to just function better. It helps in so many ways, cognitively, physically, mentally, emotionally, for your overall health and well-being. And then your second piece of your question about motivation. Motivation can be tricky, and that is a big question that a lot of people ask about. How do I just get myself to move? And everyone's also different here. So some techniques may work better than others. Many times that some people are like plan oriented. So having a friend or a family member set a time and a date. I'm going to meet you at 9 a.m. to walk by the lake firehouse, or, along the river, something like that, or around the block. So you have a dedicated time where you have to go meet somebody, and you don't want to not meet them. You said that you would. So you're going to keep that commitment, and you're going to go and you're going to do it. And then you realize, wow, I feel better after I went for that walk. So I try to tell people, keep a track or keep a log either in your mind, write it down, how you feel before you go for a walk or a run or do strength training, whatever it may be you're doing, how you feel energy wise then, and then when you're done, how do you feel? And you should have an increase in your overall sense of well-being, hopefully. So that's a great tool. Make it fun. So that's a way to make it fun too, with your friends and family. Go for bike rides, go out for a picnic, go for a walk after dinner, have family meetings, not meetings, but, everyone meets around the kitchen table to talk and have dinner. So maybe you bring that conversation outside after, and you talk a little bit more after dinner. about how your day was. Anything that is movement oriented that you can do with those that you love, it seems like it's less of an effort. And it just seems more enjoyable. I think, Melissa, you brought up a great point when we were talking previously, even like buying new gym clothes or doing something that can like just, make you more excited to go for a walk, or say, okay, you also brought this up, Melissa, if I walk 3 times this week, then I'm going to reward myself with a new running shirt or whatever it may be that you want to get for yourself. So make it maybe a gift reward system too. A lot of those are motivational tools you can kind of keep in your toolkit. But everyone is a little bit different there. In Chicago, when it's really cold, getting a gym membership might be an option, or even online classes. There's a lot of community-based cancer centers within the Chicagoland area and around the nation. And many of their classes are now virtual. So really, you can probably join a network if you wanted across, the nation in California, and you could do a yoga session with them in the comfort of your own home. If it is, really cold or rainy or what it may be. So there's lots of options.
Jenny, those are awesome suggestions. I was wondering if you could talk a little more about how exercise helps with mental health and improving your mood a little bit.
Yeah, I love that question because it is, being in the healthcare field, it has that scientific background to it. So exercise, there's immediate effects on your mood, and then there's also long-term effects on your mood. So it helps release these endorphins within your body that help regulate your mood a little bit better. So it's interesting because the way that exercise works on your body is the way that a lot of our medications to treat like depression or anxiety work too. So it helps stabilize those cellular levels that help maintain your mood or make you deal with stress a little bit better and give you that kind of feel good effect when you're exercising.
That's really helpful. Thanks so much. Jenny, just one more question for you. I have a lot of patients who ask what they're safely able to do, especially if they have a port or a central line, like a vas cath or a PICC. Do you have any suggestions?
Yeah, that's a great question. So there's there's differences between if you have an implanted port versus like if your access is, outside of your body. So there's different restrictions and accommodations that you have to make. To start, those people who have ported caths that are inserted underneath their skin, and you have to use a needle to access it. There's not as many restrictions with those once that needle is out. So it's very important to know. I actually did have a patient who loved to swim, but when he had his port needle in, he definitely knew that he couldn't swim during those times, and he had to make sure it was out. The site was healed, nothing was going on infection wise there, and he was able to swim and do exercises as he wished. It is always good to still inquire from your surgeon or your medical oncology team. Are there any restrictions I need to do because I have a port in terms of exercise? So the other central lines that you might have or be dealing with is a PICC line or a vas cath where your access is external. So there's not just a needle that gets inserted and taken out after you leave infusion, and it's underneath your skin. It's something that is open, to infectious agents. So we wouldn't want you to be swimming in those situations. And sometimes there might be some upper body restrictions in terms of exercises based on the placement. So it's always good to also ask your surgeon or your medical oncology team or hematology oncology team any restrictions that you may have with your line.
So Jenny, do you think you could lead us in a little cool down stretch or breathing?
I would love to. So I'm going to stand back up. Feel free to do this in your chair or make accommodations. So when we started with a warm up, and warm ups are very, very important because it helps reduce your risk for injury. And it just makes you move better when you're actually exercising. And then cool downs are very important to help bring your heart rate down, have you recover, stretch those muscles that you may have tensed up during your exercise workout for the day. So we're going to start with a deep breath in and raise our arms up. And we're going to deep breath out. Spiral your arms out, squeezing your shoulder blades down. Good. And again, raise up, deep breath in. And release. Good. Deep breath in. One more time. Raise up. And release. Squeezing those shoulder blades down. Good. Let's bring our hands to our side. We're going to do a little bit of a neck stretch because I think it's very important that we do this, especially with sitting at our desk or if you have a more sedentary role at work, life, with whatever it may be. Going to bring our left ear to our left neck, or left shoulder. Good. Take a deep breath in. And now, I want you to actively be moving your right shoulder blade away from your ear. And if you can, bring your arm behind you, like so. And see how that feels. If it feels a little bit different, like you're getting a little bit more of a stretch. Deep breath in. Deep breath out. Good. Deep breath in. And deep breath out. Now let's switch sides. So we're going to bring our right ear to our right shoulder. Deep breath in. And out. Actively pull that left shoulder blade down away from your ear if you can or want. You can bring your left arm like so behind you. Deep breath in. One more breath in. And out. Good. Now we are going to step back. So actually, if you are standing, that would be good. You're going to take a step back behind you. You should be able to see my foot. Yes. Left foot back. You're going to bend your right front knee, bend your left back behind you, and tilt your pelvis up. Good. And lean a little forward. So you're feeling a nice stretch right here in your hip. These muscles are very commonly tight. Breath in and breath out. Good. Breath in and out. Good. Now let's bring this foot down. So your left foot's down. Right foot is still in front of you, and you're just bending at your pelvis. So you feel a stretch in your right hamstring. Deep breath in and out. You're going just as far as you feel that stretch, and you're trying to keep a straight back when you're doing this, so you're not curving down like this. So only go as far as your body tells you. Good. Now raise yourself up and we'll do the other side. So your right foot is behind you. An exaggerated stance back. Your pelvis is tilted up. You're bending into that left knee. Your right knee is a little bent behind you. And again, this is as far as feels comfortable for you. Tilting that pelvis and going a little bit forward. Watching this front knee so it's not going too past your foot. Feeling that stretch right in your right hip muscle. Good. Deep breath in. And a deep breath out. Great. And now we're going to put that right foot down, that heel, bend at our hip. Good. Feel that stretch in your left hamstring now, and only going as far as what feels comfortable to you. Good. Deep breath in and a deep breath out. Good. And that concludes our cool down stretch.
Well, thank you so much, both Jenny and Lauren, for being with us today on The Scoop. It was so helpful to learn more about what AYAs need to know about cancer and exercise. We really appreciate all of your insight and your stretches. Thanks again.
Thank you for having me.
Thank you.
Thank you so much for joining us today on The Scoop. We hope you enjoyed our conversation and learned something new. If you want to hear more of these in the future, make sure you like our page at Lurie AYA. We hope you have a happy day.